All right, we're live. Good afternoon here in San Francisco. This is Yamini Oseguera-Bhatnagar moderating a discussion about rolling out PrEP for women. And we are here to talk with Jessica Terlikowski, Anna Forbes, and Shannon Weber about lessons learned from the female condom campaign that can inform us as we move forward in rolling out PrEP for women. First of all, let's get to know our panelists a little bit. Who are you? Tell us about your work. Jessica, maybe we'll start with you.
Sure. Yeah, my name's Jessica Terlikowski, and I work at the AIDS Foundation of Chicago, where I oversee the National Female Condom Coalition, which is a partnership of U.S.-based advocates and organizations working to improve awareness, access, and use of female condoms. And then I also oversee a project that's focused on assessing and affirming the reproductive health and rights of people living with HIV.
Thank you, Jessica. Ms. Anna Forbes, will you introduce yourself?
Sure, happy to. My name is Anna Forbes. I am an independent consultant based in Washington, D.C. at present. I've been working in HIV/AIDS one way or another full-time for the last 30 years, and my primary interest is on women in HIV, and particularly women and prevention of HIV. So I work with a number of different clients around that. I do some work with the National Female Condom Coalition. I also staff the U.S. Women in PrEP working group, so I'm looking at PrEP as an intervention for women, and a bunch of other stuff like that, but I'm mostly focused on women and HIV prevention.
And thank you so much for being with us. Shannon Weber.
Hi, thank you for having me, and thank you, Jessica and Anna, for joining us. It's so exciting to be able to chat with you and see your faces and have this conversation. So I'm the director of HIVE. We're the former Bay Area Perinatal AIDS Center based at San Francisco General Hospital. We're a preconception and pregnancy clinic that's housed in the Department of Obstetricians and Gynecologists at San Francisco General Hospital. And for probably the last 5 years, we've been also doing preconception and pregnancy visits with women not living with HIV whose partners, their male partners, have HIV. And so I've had this probably now decades-long interest in helping people who are affected by HIV have the babies that they want to, and an outgrowth of that is then really thinking about people having the sex lives that they want to, which has led me then to be interested in what does primary HIV prevention look like for women, and that's how I became connected with this amazing group of women, and I feel like it's really at the cutting edge about figuring out what's next about how to serve women and what we've learned from perinatal HIV. And we also just launched today a California PrEP provider directory. It's an online, location responsive, searchable directory, because I've learned in doing this work, well, I really want women to have access to PrEP. Unless everyone has access to PrEP, women won't have access to PrEP. And so we are also providing that service.
Thank you all so much for the work you do, and again, thank you for joining us today. Let's start by talking about the female condom campaign, because we at HIVE and many others feel like there's a lot to be learned from that decade-old struggle that can inform how we move forward to provide newer prevention technologies, HIV prevention technologies for women. So let's talk about the female condom campaign. Where is it now, and what have we learned so far? Jessica, maybe we'll start with you.
Sure. So I think there's definitely some significant lessons to be learned. Also to say, I mean, people have been looking for full implementation of female condoms for the last 20 years, which is a long time, and I think sort of keeping that in mind is really important as we look at what the struggle is and the issues that we face for full implementation of a new technology for women in the U.S. With regards to where we are with our organizing and advocacy work, we've been working really hard over the last, I would say, 16 months or so to have more female condoms be made available in the United States. And the way that we've been doing that is by working with the FDA to achieve down classification of female condoms, so that we would have really paved the way for more than one female condom option to be available in the U.S. So currently, we only have one type of product that people can choose from. And we think it's really important that there's more than one. There are a number of other products that are available around the world, and we know that variety and choice matters for consumers. And we really want to do what we can to facilitate those options. So that's where we've been at in terms of sort of our current advocacy efforts, while also continuing our work to really just have the product that we currently have available in the U.S. integrated into HIV programming and planning, as well as family planning and distribution programs, to really make sure that that tool gets out and into the hands of the women and men who need them.
Great, thank you so much. Anna, do you have anything that you want to add to that?
Yeah, I would like to add a few things. I think one of the things that we have learned very clearly from the situation with female condoms is that we who are women's health advocates and women who advocate for our own health have to push really hard to get access to new tools. You would think it would be obvious, but it's really not. And when the female condom first became publicly available in the early 90s, we just all sort of thought that, oh, here's this fantastic thing, super helpful for women whose male partners are saying, I'm not going to use a condom, maybe I'll put up with you using something, but I'm not going to use a condom no matter what. We thought this is a new tool. It's just as safe as a male condom. Obviously, it's going to catch on. And it didn't. And it didn't mainly because there wasn't a big enough push for it commercially, and also because there wasn't enough education of providers about female condoms. Healthcare providers were not familiar with it, did not know really what to make of it. And a lot of healthcare providers were either not talking to their patients in their communities at all about female condoms, or else they were sort of holding them out like, oh, here's this thing, I don't really know much about it, and it looks kind of weird and ugly, but, there it is if you want to use it. Well, that doesn't make anybody want to use it. And so we missed a really important chance to put HIV prevention into the hands of women and make it possible for them to use it, simply by not insisting that this new tool be properly introduced, and not insisting that a demand be created for it. When we look, for example, by contrast to what happened when we found out that antiretroviral drugs could be used to prevent HIV transmission from mother to child, there was a giant educational wave in the United States. There was substantial federal funding to make providers aware of the fact that if they had HIV-positive women in their practices, they urgently needed to make sure that these women knew that there was a way they could prevent their babies from becoming positive. And that was great. But that's also what should have happened with the female condom, and it's what should be happening now with PrEP. There should be this wave to create a demand for new products that can protect women and save their lives, and there hasn't been. And that's why the kind of advocacy that the National Female Condom Coalition and the U.S. Women in PrEP Working Group are doing are so important, and why a lot more people need to be taking it up to create the demand.
Mm-hmm.
Anna, thank you for bringing that new dimension into this conversation about prevention of transmission from mother to child, and a lesson that's definitely been learned from that. Let's talk about PrEP implementation for women in the U.S. and what that has looked like so far. Shannon, will you share for us?
You bet. So, in fact, a lot of exciting things have happened over the last few years for PrEP implementation for women. One, we have heaps of guidelines that now include the provision or offering of PrEP to women, including the Centers for Disease Control PrEP guidelines, ACOG, which is the American College of Obstetricians and Gynecologists, the National Perinatal HIV guidelines. Also, the family planning guidelines include HIV prevention as a core family planning service. That's new from last year. And then also the Reproductive Endocrinologist Society just updated their recommendations and included PrEP for around safer conception. And so, and this is important because all of them also reference, in one degree or another, women using PrEP during attempts to become pregnant, during pregnancy, and breastfeeding. So this is important because we are seeing PrEP is endorsed for women because PrEP works for women. PrEP works when it's taken. So this is some basic things that we know, and then also the support we have for rolling something out with the guidelines backing it up. Now, what do we know about uptake among PrEP women and PrEP? So there's some prescription data that's available, and there's heaps of flaws to this data. I won't get into all of that. But bottom line, what it's shown over the last couple years is that the amount of women that this data says are taking PrEP has remained consistent, while that number of men has dramatically increased. And so while I don't totally buy the whole story about the numbers, I do believe that it's very true that we've seen a much larger uptake among men than among women. And I think that there's several reasons why, although we'll talk much more about that today, and the biggest thing is that we don't totally know why, and there's a lot more for us to learn. One, there's a huge access issue regardless of your gender around Medicaid expansion. So the places in which we know people are accessing PrEP and accessing it in a large scale, and this would be largely, again, men, are in Medicaid expanded states. So we have to talk about access to primary health care. That's what PrEP is. It's a core part of just your general health as one of the impediments to anyone, again, regardless of your gender, to accessing PrEP. And then two, we have just not seen the educational outreach and efforts towards women and providers who serve women that we have seen in relation to the kind of educational outreach and efforts towards men who have sex with men or gay or bisexual men and their providers. One of the things that I think we can also continue to struggle with as women's health advocates, as women ourselves, is that one of the things we've learned from this early PrEP implementation, and I don't know that it surprises us, but we just have qualitative data coming in over and over again to tell us that women, regardless of where we are, even in settings of elevated HIV exposure, we do not believe ourselves to be at risk, at least in the near term. And so this is going to really impact uptake when we don't believe that we're at risk. So we've then struggled as public health people and women's advocates in that we haven't quite figured out how to message well and how to figure out how to support women in understanding their HIV risk. And as all of these things also kind of play into my last point, which is that we don't have the same number of champions in terms of PrEP users that are women. So I think that this is one of the areas that has really helped the PrEP movement for men who have sex with men just take off, is all these amazing stories of men of every shape, taste, background, all over the world, all over this country, and they've come out, and the tremendous support that they've gotten from a community. And so we now have all these faces. I could go look online today and find all kinds of people that I'm either attracted to or that I feel are similar to my story if I'm a man who has sex with men. And we have some amazing women, including Poppy, who've come forward and told their story about PrEP, but we just don't have the same visibility or the number and types of women telling their story around PrEP use.
Great, thank you. So we have talked in the past with Jessica and Anna and others about how important it is to create a demand for a product, especially sort of women's health product, a public health product, and in creating a demand, how important it is to sort of create or spread awareness about it. And so what we wanted to do next was talk about how, specifically for PrEP, how can we build that awareness to create that demand to sort of deal with the issues that Shannon was just talking about. Jessica, do you have any thoughts on that?
Yeah, I mean, I think part of it really is finding those champions, right? Whether those champions are people who are PrEP users themselves, which I frankly think is going to be very challenging to find among women who are going to come out and be like, yes, I'm a PrEP user, I'm out and I'm proud, because there's a lot of stigma about women's sexuality, right? About what kind of sex women have, whether they should be having sex and with whom and what quantity and at their to meet their own desires. And I think that really matters. I also think because they have to reveal what their partner status would be, yeah. Right? So it's not just about their own their own sort of personal lives, but that of the life and decision of their partner too. And I think that comes into decision making as well. And we've seen this a lot even with female condoms. We were talking about if you were just to talk about condoms, like that's a pretty normalized idea, right? Condoms aren't a new idea, but you talk about female condoms and us trying to find women who were willing to come out and be like, I'm a female condom user, I have a positive experience with them, I like to use them, they feel good, my partner and I use them for a variety of reasons. It was really challenging for us to find women in the U.S. to come out and be that vocal about it. And I think that has to do with the fact that there is a lot of shame and stigma in terms of talking about women's sexuality, which is deeply problematic for many, many reasons that can be a whole other hangout conversation that we have. But I think, I think that it's important to kind of note that. I think in terms of when we're talking about who do we engage in other ways to kind of cultivate champions, I think part of it is really working to build that awareness, to identify those individuals and entities that interact and interface with women on a regular basis, folks that are trusted sources of information. So whether that's, basically from a person's hairdresser down to their medical provider, right? And really looking at those individuals that are having conversations on a regular basis with the women that they serve, and getting them to understand that it's important to have conversations about HIV vulnerability and the ways in which they can reduce that vulnerability, right? And PrEP being part of that. So, we're going to be, actually rolling this out full tilt in the new year, this project that's focused on really building providers' capacity and understanding of the range of prevention options that are out there, and PrEP being a big part of that, and getting them to talk with the women that they serve about HIV, but also about PrEP and the ways in which they can reduce their risk.
Mm-hmm.
Thank you. So excited to know and hear more about that in the new year. Anna, will you share your thoughts about sort of what are ways to build awareness to create the demand for newer prevention technologies like PrEP?
I would be happy to. There was data presented last March at a conference in Paris that showed that about 25,000 people in the U.S. may be on PrEP now. And of course, the U.S. is the first country that where PrEP has been approved for use, so it's the first country where there is wide-scale use happening. Of those, 80% were gay white men who were getting it through private insurance. 80%. So I think it's really, really important for us to look at how we're promoting PrEP to women and are not promoting PrEP to women, and to think about how we may need to do this differently. I actually would take the position that we don't use the same mechanisms to promote PrEP to women that we do to men. I think that, as Jessica was saying, the way that most women think about and talk about their social lives and their sexual lives is very different from the way, especially that gay white men may do so, because they have to do it much more in the context of their families and their communities. What does this cause my neighbors to think about me? What does it mean for my kids if somebody finds out that I'm PrEP? Oh my gosh, all of a sudden it raises the idea that one of the parents may have HIV. Oh my goodness, what does that mean? So I think that we may be looking for PrEP champions in the same way as we see them in the gay male world may not work for us. We may not be able to have individuals standing up saying, I'm taking PrEP and I'm proud of it and I have no shame around it. For younger women who don't have families, particularly younger affluent women who have independence and don't have to worry about stigma quite as much, yeah, that may be a possibility. But I think for most women, the way it's going to happen successfully is, again, through the providers, through the communities, through the church groups, through the beauty parlors, through, the mothers groups. It's going to have to be women to women talking to each other in small groups, because that's the way that women accept information and relate to information, particularly when they're talking about issues that are stigmatizing. And I actually think, this may be, a crazy fantasy of mine, but I actually think that we may be able to help women move beyond their denial of their own HIV risk when we get to that place, and when we have those kinds of conversations happening in a really lively, really broad broad spectrum manner. Because what do we do when we think we may be at risk of something and we don't feel that there's anything we can do about it? We deny it. If I think that my husband or my boyfriend has HIV and I'm going to bed with him every night and he may not be using condoms all the time, he may not like condoms, I have to deny my risk, because otherwise I have to sit there and think, oh my God, I'm putting myself at risk every single time I have sex with this man that I love. That's not tolerable. But as soon as we say, okay, here's a way that you can control that risk yourself, you can control it without jeopardizing your relationship, you can control it without being seen as accusing your partner of anything or raising a lot of uncomfortable issues about who's being faithful to whom and so forth, then women become able to manage the risk. And I think that because we've seen the direct parallel with contraception, that women didn't talk about a lot about fears about getting pregnant again, or we all had to talk about it as though this is the way it should be and there's nothing we can do about it. And there was denial of the risk until women had the pill, until we had modern contraception that allowed us to take some kind of control. And at that point, women became able to say to themselves, oh, well, you know what, maybe I really should be protecting myself. Because then there was an alternative. Then there was a way to talk about it and think about it and act on it without jeopardizing your relationships, without jeopardizing your place in the community, without scaring the heck out of your kids. I think that's a model we need to use, I think, for PrEP. And that leads me right into my last point, which is that I think we really, really need to be pushing hard to get PrEP as a standard piece of what's discussed in family planning clinics. Because surveys show that women who don't receive any other health care in the course of a year still go in for their family planning visits. It's the one source of health care that most women try very hard to get to if they possibly can. And so it's the logical place for us to be investing a lot in terms of trying to educate people about PrEP, make it a common part of the conversation, a natural thing that the family planning provider brings up. Oh, did you know that this is out here? Maybe you need it, maybe you know somebody who needs it, but you should certainly know that it exists. We prescribe it here. It's easy for you to get. We can help you with the funding to get the pills if you need it. I think that's at the point at which women start to take it up. And that's a very different model, from the handsome-looking guys in the magazines touting PrEP.
Great, thank you. So this really leads us into sort of the next piece of this. So we've talked about kind of this overall normalizing the conversation. We've talked about sort of everyone from your hairdresser to your pharmacist kind of talking the same talk about PrEP. So it leads us to the next question, which is it's clearly important to engage community, to engage women, to engage fellow consumers, sort of gatekeepers and spark plugs, which is a term that you all have sort of brought to us in the past. Let's talk about how are women made part of the conversation with female condoms and with the female condom campaign, and how can that moving forward be done for PrEP as well? How can we really integrate women into that conversation to sort of inform how we move forward? And maybe we can start again with Jessica.
Sure. Yeah, I think, in terms of that idea of sort of having a spark plug, I think it's that idea of sort of having folks that have that fire in the belly and a real desire to make sure that people who, not just, sort of other people, but for ourselves too, get the tools and the resources that we need in order to have sexually healthy lives, right? And I think that one of the ways in which we do that is through doing a lot of education and awareness building and really providing a space and place for people to feel like they can get involved in that work, which really matters. I think, there's one of the big pieces that we've seen with female condoms is that, and one of the biggest challenges is that, so few women, even today, even 20 years after we've had the female condom, even that there's a number of other options available around the world, too few women even know that that's an option that's out there for them. Why is that the case? Because you can't find them in pharmacies consistently. Your medical provider doesn't talk about it with you as a prevention option. You're not hearing about it or seeing about it in a consistent way, or in the places that you frequent. And that is a huge disservice to women. If we had a significant investment in, efforts to make female condoms more visible, to really help build that awareness, which ultimately enables the building of that demand, I think we'd be in a really different place. But we haven't had that to date. And so it's really been happening in sort of more, I would say, at least within the U.S. context, within smaller sort of bits and pieces in different cities across the country, which has been exciting to see that growth, but then at the same time is very challenging in terms of sort of looking at a coordinated national response to investing in female condoms to make them available to all people everywhere. Mm-hmm. I do think that we have an opportunity with talking about with the CDC and the Office of Population Affairs saying that HIV prevention is a part of family planning, that really seeks to sort of change the dynamic a bit here, because you can see that there's more opportunity for medical providers to talk about PrEP with their patients, to talk about female condoms as the only dual method prevention option available. But part of it is getting them to do that. So I think, and the way that we do that is by continuing our efforts to engage those sort of lists of constituents and stakeholders that we had mentioned earlier.
Great, thank you. Anna, did you have anything to add to that?
Yeah, I would certainly agree and support everything that Jessica just said. I think that we're all spark plugs. We all have the capacity to go into a drugstore, look at the shelf, see if the female condoms are there besides the male condoms, and if they're not, to go to the pharmacist and say, hey, where are the female condoms? How come they're not there? They will most likely say to you, that's because there's no demand for them. We used to carry them, but we don't carry them anymore because nobody buys them. The only way that we change that and get them back into stores is by a lot of women going in and saying, where are the female condoms? We want them. And I think similarly, when we go to our family planning providers or our GPs or any other health facility, asking, do you talk about PrEP? Do you talk about pre-exposure prophylaxis? Do you have female condoms here available for people? We have to ask for them. Women are really, really bad at this. And part of the reason we always end up on the short end of the stick is that we're always taking care of everybody else's needs, and we feel as though it's somehow tacky and awful to advocate for our own needs. But I'll tell you, if women who have the privilege of having education, having some economic resources, some independence and so forth, if we don't do this, we can never expect people who don't have those advantages to do it, because the word is simply not filtering down to them. We have to demand that our governments spend more money and spend more resources on improving all kinds of women's health services, which is certainly very much part of HIV prevention. As Jessica said, we have to advocate for these services being available in family planning clinics everywhere, and that means advocating for funding for female family planning clinics to exist. The idea that somebody like Planned Parenthood is being defunded is the worst insult to women's health that anyone could imagine. It says our lives don't matter. It says that our health does not matter, and that says that our families don't matter and our kids don't matter. It's a wrong priority. And I'll get off my soapbox now, but I think it's really important that we see this as part of a much larger political picture, because it is part of a larger political picture. And it's not, I think we've had such a great experience and learned so much doing advocacy within the HIV/AIDS movement, or at least I certainly have. And we've picked up so much from a lot of the leadership in that movement, which is male, about how to advocate for your own needs. And we've seen such remarkable successes that it's easy for us to forget that strategies that work to promote issues related to male health don't always work to promote issues related to female health, because female health is regarded very differently. And that we have an extra fight that we have to put in on this that's not going to be identically the same to the fight for gay men. It's going to also have to do with our fight for women's health generically.
Mm-hmm. Thank you so much for lighting a little fire under our butts. Clearly, we have a major responsibility to our community and to our sisters, and to continue sort of advocacy for women's health on a political level, on a national level, etc. Shannon, will you share with us what your thoughts are on how you feel like in the sort of movement for PrEP access for women, how can we engage our sisters? How can we engage women, community members, sort of these spark plugs? Where do we find them, and what do we do?
Yeah, it's such a great question, and so important to have these kinds of conversations where we can learn from each other. In my mind, we need spark plugs at every access point, right? We need spark plugs in the community. We need spark plugs that are family planning providers, that are general practitioners, that are OBGYNs. We need policy spark plugs. We need funders that are spark plugs. So we need spark plugs at every level right now to move this forward for women. I want to dovetail a little bit off what Anna just spoke about women's health, because I think it absolutely relates to the lack of access we've seen for women, and really disempowered conversation around PrEP for women. So we live in a country on which any day of the week I can walk down the street and see on the front page of the newspaper a message that says loud and clear to me that my choice about my body, my access to reproductive health, does not belong to me but belongs to public opinion. And so how does that message then impact me? When I go to have my gynecological exam, where I assume if you're getting up in my vagina, you're helping me take care of my reproductive and my sexual health needs. And this is actually just not true. It's a really siloed approach. We're having these conversations right now largely among HIV people, HIV prevention folks. And for women, for our bodies, it's the same place. HIV prevention, pregnancy prevention, planning a pregnancy, it's all happening in the same place. Unplanned pregnancy and HIV transmission happen generally by the same act, condomless sex with a man. So we have a lot of work to do to build on this decades-long success, even though there's still challenges around our rights to access family planning, that there's multiple options available to us. I think about now how by the time my daughter was 13, we knew she could go to the teen clinic at Kaiser, which is where we get our care, and access care without my permission. What an empowering message to her, right? That she has, again, we're privileged in that we have access to insurance, but that she has a right to that information. Where do we as women get that same information about HIV prevention? It's just not happening. So we have work to do on that level. So my point being, we have to integrate sexual and reproductive health. For women, it's the same thing. And the disparities are the same between HIV prevention and reproductive health. So we've got to come together and work together. And then I want to talk a little bit more about some of these nuances around PrEP for women, and maybe then we think about how to engage spark plugs. So I want to talk a little bit again about women coming forward, and if that means that they're out their partner status, we have to put on the table that how much HIV criminalization there is in this country. So as much as we can be angry at men for not coming forward, or angry at men for not engaging around prevention, whether that's family planning or HIV prevention topics, let's look at the messages that people living with HIV are given. And there's been some pretty ugly messages, particularly given to men of color recently, about their HIV status. And so you think about the pressure that happens in a couple as they negotiate around how is it that they're going to tell their story, how is it that they engage in care, and decriminalizing HIV has got to be a part of the conversation if we want to move forward and make it safe for women and the people that they love. Two, what is something that we know, this is another uncomfortable part of the story, is that what women who have HIV, women living with HIV have almost universally in common is histories of trauma and or intimate partner violence. And these are two different types of violence, but they can intersect, and some women have one or both or multiple. And so when we also look at communities in which there's background levels of violence against women, I think we still have this in the US, but we're going to really struggle with this about rolling out PrEP globally. This is another piece that we have to bring into the conversation and talk about how do we also do it in an empowering way. We can't just tell the story about women being victims, but we also can't just march forward without acknowledging this the criminalization piece for men, and the huge role that trauma and violence and the disproportionate power in relationships that exist between men and women. And so, to wrap up on somewhat of a hopeful note, I would say that those are big things to work on, this integration of reproductive and sexual health, decriminalizing HIV, and then working on trauma as it relates to women. But what can we do in the meantime? I think one of the things that we can do is when a woman or a man who's living with HIV who has sex with a woman comes forward and tells their story, whether or not we like all things about them, we can champion them, and for their parts coming forward, we can create safe spaces. And this can be a lot of work to go in the comment section and say good things, to reach out and send a message on Facebook, to stand there and hold someone's hand when they say, wow, that didn't turn out the way I thought when I, disclosed. So this is the real important individual one-on-one work we can do to invite people to come forward as we work to make it a safer world for them to continue to do that.
Shannon, thank you for providing some really concrete ways in which we can support each other and we can move forward in sort of supporting women to be part of the revolution, in a sense. I'm going to skip forward a little bit, and what I'd like to talk about is newer technologies coming in. In a video we had done with Jessica a while ago, for which there will be a link at the end of this broadcast, we had talked about how newer technologies sort of fuel the regeneration of the conversation, and have done that for female condoms. And as we move forward with HIV prevention and PrEP and newer, fresher biomedical interventions, how can this sort of reinvigorate the conversation each time? And how can we integrate all of these newer technologies and older technologies like the female condom to sort of have this combined HIV prevention and family planning sort of toolkit for women? Jessica, will you share with us?
Yeah, I mean, I think one of the things that I've been most encouraged by and really excited by has been the resurgence. I don't even know if it's fair to call it a resurgence. It's new energy, I would say, in PrEP. And people talking about using PrEP as not just for occupational, potential occupational exposure, but talking about it in terms of sexual exposure or risk of injection drug use and that type of thing. And I think I've been really impressed and encouraged to see first of all, individuals like the community, right, coming up around this, but that so many cities are now using this as a way, because of PrEP, to talk more about PrEP, to talk about, or if you have someone who's coming in for PrEP more than one time, to use that as a transitionary way, a transitionary point to get them onto PrEP. And I think that is really exciting, and I think that would not have happened without PrEP coming online. That PrEP would have stayed this underutilized sort of, I don't even know, marginalized tool that is effective but not used at all. And so I'm curious, actually, and I don't know the answer to this. I don't know if Anna or Shannon might, but sort of looking at like what the rates of uptake around PrEP have been ever since we've had PrEP come online. And I'd be really curious to sort of know more about that. So that's more going down this PrEP line. So sorry, not off the female, going off the female condom tip a little bit. But I do think, as we, with looking at newer technologies, I think it does give us an opportunity to talk about other technologies like the female condom as well. And I think the reason is because of the lessons that there are to be learned, that the challenges that we face in terms of implementation, in terms of uptake, are incredibly relevant for PrEP. And it's an opportunity for us to say, hey, why don't we pay attention to what some of these issues were intervention 20 years ago, and see what we can do to make this work better this time for women in particular. And I think, I think it was Anna who started off the point earlier in the conversation about the amount of political will and investment that went into preventing vertical transmission, right? Whenever we found out that that was a viable and highly effective way to reduce HIV, there was significant investment and political will there, and that's what made that successful. And I think that's what we also have to look at, is how we mobilize that political will and build that demand so that people are taking action, and saying that it's not sufficient for women to not have access to options. If we're talking about rolling out PrEP and investing in PrEP for, primarily, and if you look at most of the cities, right, and this makes sense because of the epidemic, we're talking about gay men and trans women. but we also need to make sure that we're not leaving cisgendered women out of the conversation, and we're making sure that they get the tools and resources they need to be able to protect their own health as well. But there's got to be that political will, and that's on us. Like, that comes back to that point, Yamini, that you said earlier about the responsibility that we have to our communities to really get active, to get vocal, and to say it's not acceptable to not make these resources available. And I think one way in which we do that is a real simple one. Whenever we're talking to health clinics, we're talking to health departments, we're talking to community-based organizations who make the case that they'll defend not investing in female condoms and making options available, when in fact the real question is, why aren't you making options available for women that's who we're talking about? Like, are women a priority that you're serving or not? Like, do the women and the women's lives or the lives of women in your community matter? Like, that's what we're talking about when we're talking about whether or not investment is being made.
Jessica, thank you for two things. Thank you for bringing PrEP back up, which is such an important conversation, and it really is such a good example of how newer technologies kind of reinvigorate the conversation around older ones, and how these are all important tools in this sort of combined and very sort of full array of options that women can have access to, and we're moving forward to see newer and better options as well. So thank you for that. And let's move on to Anna. Anna, did you have anything to add to that for us?
I always have something to add. Yeah, and I always
love that about you.
And I almost always agree with Jessica as well. I do think that having new options come online is helpful, in large part actually, because it helps us to move away from the HIV prevention equals condoms scenario. I mean, we have spent so many decades now kind of beating people over the head with the idea that you have to use a condom, have to use a condom, have to use a condom to prevent HIV. And it's certainly a great idea, but we also know from the statistics that there are a lot of people who aren't using condoms, at least aren't using them consistently. And I think for a lot of those folks, the idea of HIV prevention has kind of clicked off in their heads, because the only option that's being offered to them is something that they don't want to do or can't do, in the case of a woman whose partner won't use a condom or permit the use of a female condom. And so people have kind of disconnected. So I think that when PrEP came online, it offered another way of thinking about HIV prevention. And I think part of the reason that the uptake has been slower than we would like it to be is that the idea of there being another HIV prevention technology just kind of blew everybody away. As Jessica said, people had stopped thinking about PrEP because it was something that was mostly being done in a workplace setting. For an accident, a needle stick or something that happened in the hospital. It wasn't something that regular people were using on a regular basis, mainly because health departments weren't making it affordable and insurance companies weren't making it affordable because it is expensive. But now we have PrEP. Now we're talking about injectable PrEP, which may be within the next few years. And next year we're going to have the results on the microbicidal ring. The little ring that looks like a Nuva ring, except instead of being loaded with contraceptives, it's loaded with antiretrovirals. And if that proves to be successful and effective, it's something that could really change the conversation again, because here would be something a woman could insert, leave in for a month, not have to take a pill every day. So adherence would presumably be less of an issue. And that might change the conversation again in terms of how people think about HIV prevention and how they think about their relationship with HIV prevention. Does it have anything to do with me? Is it something I need to think about? One thing that we've seen very, very clearly from the contraceptive world is that the more options women have in contraception, the more likely they are to use something. For the woman who doesn't want to use a pill, maybe she wants to use a patch, maybe she wants to use an insert. Some people like the diaphragm, other people like IUDs. The fact that there are a lot of options means that there's a lot of room for women to say, this doesn't really work with my life, but maybe that would, maybe I could try it. And I think that gives people a lot more willingness to interact directly with the idea of protecting themselves, the possibility of protecting themselves, and that they have choices in the ways that they can do that. And so I think that new HIV prevention options will similarly create an environment in which we can expand the number of choices and expand how people know about and think about the choices and how they think about their HIV risk. Now, all of that, of course, is premised on generating a whole lot more dialogue. And we've talked a lot about the need to do that. So I think that really has to be our first priority as we keep our eye on what's coming down the pike, but not waiting for it, not waiting for new tools. Getting as much conversation about HIV prevention going now, building as much political will as we can now, so that as the pipeline increases, more and more people can access it.
Mm-hmm.
Thank you. That's a great point, and that's part of what we're doing here, right? Is creating that dialogue and sort of pushing for more of this. I just want to say really quickly, this would be a great time for anyone who's viewing to type in some questions that we'll answer in sort of the next few minutes, in the last few minutes of this broadcast. Shannon, did you have any thoughts on newer technologies and how newer technologies can help us sort of reinvigorate old conversations?
Yeah, I think that if we can just take 2 steps back and kind of look at this, and this is building on what Jessica and Anna have already said, but maybe kind of capturing it in a slightly different way, which is that this is nothing less than a radical paradigm shift. Mm-hmm. And we went from a scenario, 1, in which women were offered no choices, and 2, the best kind of screening that happened was, how many times did you use condoms in the last week? We'd come up with ways to be as accepting as possible about the way in which we ask these questions. But the reality is, we had PrEP there, wasn't offered to women. Female condoms were there, they still aren't offered to women. And so with the advent or the coming of PrEP onto this landscape, and also treatment as prevention came at the same time, and we haven't yet mentioned that for women who know their partner status and that's a choice they want to make. We have an array of options, and we're struggling as a system about how do we give options to people, but perhaps particularly to women. And so to me, the newer technology, it's a gift that we are struggling now, so that as newer technologies come, that we're better prepared. If a vaccine came down the pipeline, we would not be able to deliver it, right? We're seeing that very clearly right now. And so we have this opportunity with PrEP to really break this all apart and say, how can we put it back together in a way that better serves people, that's cost effective, that helps us long term, that's a sexual health model. And so I would say that then my short answer to that is, how do the newer technologies help? It's that they offer choice to women, and what we need to then do with them is actually give women a choice. So it's not a choice when you decide for me that I'm not going to like a female condom because you didn't like it and so you don't offer it to me. Or it's not a choice when you decide you don't think treatment as prevention is good, so you don't bring it up. It's a choice when it's actually laid out in front of me, and I can choose at that one time, and another time, 6 months later, 1 year later, I might have a different choice that I want to make. All of this allows women to opt in to a wellness model and really provides ongoing conversations with the provider, which some reproductive health providers are going to be super comfortable with. Some primary care folks are going to be less comfortable with, but we can build that skill. So I would like to just say it's about actually giving women choice.
Great. Thank you so much for all these amazing words. I'd like to transition us into answering a couple of questions because we're starting to run out of time.
Can we ask a question about that? So can we see the questions or only you?
I think it's only me.
No, I can see them.
The QA. Oh. I was clicked on chat, not QA. Sorry.
Yeah, so you can see them then.
Yeah.
Oh, yeah. There was some finger snapping for Anna. I missed it.
Right. I don't see how you do this.
So Anna, you just click on a little icon that says Q&A on your left bar.
I see it now.
Oh, right. Thank you.
So the first one I want to address is that someone snaps fingers at Anna Forbes because she's fierce.
Thank you. I snap
but let's answer this first question, which is really, I think, directed to Jessica, because Jessica, you brought it up. What is a spark plug? Tell us.
Oh, I actually think this is an Anna. I think this is an Anna-ism.
Oh,
I think it is actually.
Yeah.
Snapping.
We are spark plugs. All of us who are getting out there and talking about this and will not shut up are the spark plugs. It's the people who are, and all of you, I would imagine, who are listening to this webcast are spark plugs, because you wouldn't be tuned in probably otherwise. Female sexuality is a topic that makes a lot of people, women and men, nervous and uncomfortable. And I don't want to offend anybody or push anybody, totally beyond their comfort range, but I do think that those of us who care very deeply about this and feel that women's lives really are important and they are worth saving have to learn how to talk about it relentlessly, and how to try to engage other people in talking about it, and try to engage people in activities that can help move the ball forward. One of the things that's really important with the National Female Condom Coalition is that it's an organization that has branches in a lot of different states, and a lot of different spark plugs are out there with the National Female Condom Coalition trying to expand access to female condoms in their own area. That's what I mean when I talk about spark plugs, and that's what we can all be, is people who try to figure out how to make stuff start to happen in your own area, and there are lots of groups that can help you do that.
Great. Thank you so much. This next question is about, it says, how successful have you been in partnering with primary care providers in your respective cities to roll out PrEP use for women? And it's kind of related to a question that I had that we didn't really have time, that we didn't really end up having time to get into, is how do these technologies roll out differently in different places? So maybe we could actually get an answer from all three of you about either the female condom or moving forward with PrEP. What have we learned there? How is it geographically different to roll out a prevention technology? Shannon, let's start with you.
Yeah, it's great. Exciting in San Francisco is that just about 2 weeks ago, our Department of Public Health rolled out a PrEP clinic at Ward 86, and that is partnering with the federally qualified health centers around San Francisco to make sure, and they've already trained, but to make sure that PrEP is offered in all of those clinics. And we've been meeting with them to make sure, as they're building out the database, that women are included in that, and then even going further upstream, working with the HIV clinics to see about men who may have sex with women, about making sure that their partners are referred to the PrEP clinic. So we're in the early stages, but I see it as a really promising way of PrEP being universally or potentially universally offered across the health system.
Great. Thanks a lot. Jessica, do you have any thoughts on that?
Yeah, I would say, I could speak from the perspective of Chicago a little bit, and then also sort of some of the work that we're getting ready to begin in the rest of the Midwest. I think, what we're seeing in Chicago is, there's been more conversations that are being had between medical providers and their patients, and we know that we recently opened up a PrEP clinic at the University of Illinois Chicago Core Center, which is a HIV clinic, but now they're also delivering PrEP. And there's a small number of women who are coming there. There's a small number of women who are going to Howard Brown Health Center, which is an LGBT center. There's another small group going to another place. So we're seeing these little pockets, right, of women who are accessing PrEP through their medical providers. But the providers that they're going to are also fierce advocates, right? These are people who are, they were motivated and committed to implementing PrEP within their institutions, and that's made a really big difference, I would say. I think, we're also rolling out what's going to be a huge PrEP awareness campaign throughout the city that's targeting gay men, trans women, and then also cisgendered women throughout the city, specifically Black cisgendered women, and really focusing on getting them involved and talking about the positive aspects of PrEP in a way that really highlights it really talks about it more in a sex-positive kind of way, not just talking about disease prevention. And I think that's also going to make a difference in terms of how people receive that information and their willingness to want to know more about it as well.
Right.
Oh, can I add one other thing, actually?
Yes. Please.
the other thing I wanted to say too is I want to give big props to one of our partners, which is Planned Parenthood of Illinois, who's actually been working to integrate PrEP into their clinic, to their reproductive health care. So we're really excited to have a really committed nurse who's there, who's been leading this effort and really working hard to make sure that clinics around the state understand what PrEP is, know what it is, know how to integrate it into conversations with their patients, and we're really excited to see sort of how that develops. But that's been a newer development, and I think it's really gonna have a profound impact.
See, now that nurse is a spark plug. That's what.
Yeah, Brenda Wolf, we love her. She's amazing.
Thanks, Anna. Did you have any thoughts? I know you're really working hard with the U.S. Women in PrEP Working Group. How is this rolling out differently in different places?
It's rolling out very, very differently in different places, and far more on the West Coast and now in the Midwest, thanks to what AIDS Foundation of Chicago and the health department there are doing. But I think what's really important for people to know is that the National HIV/AIDS Strategy makes it very clear that PrEP rollout is supposed to be happening, and the National Association of State and Territorial Health Directors, National Association AIDS Directors, sorry, NASDAD, is working with health departments in all the different states and territories to try to encourage them to push out PrEP. So wherever you are in the country, you can go to your health department and say, what are you doing about PrEP? You may very well, in some states, run into people who have never heard of it and have no idea what you're talking about, and you may run into health departments that are not doing anything about it, but they're supposed to be doing something about it, and that's what the message advocates need to take to the health departments is, this is here, it's in the National HIV/AIDS Strategy, it's very clear, the FDA has approved it, this is something that we should be seeing roll out, and how can we work with you to do that? How can we support you in doing that? How can we educate the public to demand that you do that? Because it's crazy, especially for women. I mean, think about it. Here we finally have something that a woman can use to protect herself, something we've wanted for 30 years of the epidemic, not to mention millennia before that. But 30 years we've been waiting for something women could use to protect themselves by themselves without partner involvement. And the vast majority of the women in this country don't have any idea that it even exists. That's not okay. We have to demand it.
Well, Anna Forbes, Jessica Terlikowski, and Shannon Weber, you are fierce women, and we thank you for the work that you do, the work that you're going to do, and thank you so much for joining us today.
Thank you.
We're going to end our broadcast soon, and I'm going to put up a slide that'll have a couple links that you can click on to see some of the content we have on the HIVEonline.org website. Thank you for the questions. We weren't able to answer all, but we'll have more of these, and hope to see you all again soon. Thank you.
Great.
Thank
you.